The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health educational purposes only, and complies with all HIPAA regulations. Enjoy the show.
Hi, audience, folks, ladies and gentlemen. I'm Dr. Fazil. You're watching Dr. Fazil TV show. This is September 2023 episode of Dr. Fazil TV show. So today we are going to talk about a very common problem, that is arthritis. Now, the term arthritis means a pain in the inflammation in the joints. Arthralgia means pain in the joint. So they're both a change one way or the other way, but arthritis is the most common term being used. So we have to know that arthritis is not a specific diagnosis. It is a condition. So people can have arthritis of a different kind. Arthritis just means inflammation of the joints, or in layman terminology, pain in the joints. Shoulder pain, knee pain, ankle pain, neck pain, or other certain joints like fingers and hands. So when we make a diagnosis of arthritis, most commonly it is considered osteoarthritis. Osteoarthritis is a mechanical pain. It's a mechanical condition. That means bone erosion, loss of cartilage. Cartilage is a slippery membrane on the top of the bones, and some joints, they slide or glide on top of each other. And with a period of time, that cartilage become less viscous, or it gets worn off, and then we call it bone and bone. That's a common terminology we say in medical conditions. When somebody have joint pain and we do an X-ray or MRI or CAT scan for that measure, that's how you take the picture of the joints, is by those modalities. So that will show us what is the anatomy of the joints. Now, joints come in different sizes. We categorize them in small joints, medium joints, and large joints. The example of large joints are shoulders, hips. Those are the large joints. Small joints are like hands, wrists. The small joints are like fingers, and the medium joints are like elbows and wrists and stuff like that. So when we are making diagnosis, we say, hey, you have osteoarthritis of large joints or medium joints or all the joints. Again, osteoarthritis is the most common kind of joint pain or joint condition, but there are other conditions too which we have to be vigilant about. For example, gout is very common with the high uric acid, which causes accumulation of crystals of uric acid in the joints, and that can cause pain. Generally, you see gout in the first toe of the foot, but you can also see that in other parts too. So you have to be vigilant that not label every single thing as osteoarthritis, because the treatment is different. For osteoarthritis, is generally the pain is get worse with movements and get better with the rest. So the patient generally complain that they have pain mostly when they wake up in the morning. The pain is less, and as the day goes by, the pain gets worse. That's kind of classical condition of osteoarthritis. So
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
So let me bring in this joint as the hip joint, you can see. And we have done the MRI, and you can see, well, this is general anatomy of the hip joint. You can see there's a bone inside like a cup, and there's a femur bone which is going inside the cup. And then you can see the cartilage is being lost, and this bone is rubbing against the bone. And then when patient walks, it grinds against the bone and causes pain. So the treatment would be obviously, if the pain is worse, if the pain is a little bit, if there's no kidney problems, because NSAIDs or ibuprofen, Motrin, and levothyroxine is bad for the kidney. They can take Tylenol. Physical exercise helps to build up the muscle mass, so the brunt of the weight is, passed onto the muscles instead of joint. And then also weight loss, because if you're very heavy, obviously you're gonna burn out your joint fast, and you can have a lot more pain. So on that note, if the pain is worse and nothing is working, sometimes we can give a cortisone shot in the joints. It works for a short while. But if that doesn't work out for the hip, I'm talking about hip now, let this picture go away, then you can see that the next option would be the hip replacement. Remember, the hip surgery or knee surgery or any joint surgery is not a medical condition. That's your personal choice. You do it when nothing else works and your social life or your day-to-day life is getting difficult to do your daily task. At that time, if there's no contraindication, then you see the orthopedic specialist to have the surgery done. There's no medical condition that will dictate that. It is your call. If the pain is unbearable, nothing has worked, you have burnt out through all the conservative treatment, at that time you will ask for orthopedic referral or see an orthopedic specialist, which are joint specialists, and then they can replace the joint completely or partially. That's one option. They don't have to replace the joint. They can do something known as arthroplasty or laparoscopic arthroplasty, where, or just arthroplasty, where they actually just repair the joint. For example, if the meniscus, which is the slippery membrane between the bones, has cracks or has worn out, they can replace that or fix it, or if the ligament is broken, they can fix it. In the shoulder joint, there's a group of the muscles around the shoulder joint known as rotator cuff. Let's bring the rotator cuff here. You can see the anatomy. There's the muscles. There's a group of muscles around the shoulder joint. We'll call it rotator cuff. And that can cause, you can see right here, there's a crack. So rotator cuff tear, if it's partial, that means just like you can see this is partial, then the treatment is just physical exercise and mostly the pain will go away. Let's bring the next hologram, and this is gone. Here you can see this is a complete tear. The tear is complete through and through. Generally the supraspinatus muscle, the muscle on the top, and the treatment would be obviously surgery. It will not regrow by itself. So and the diagnosis you generally do by the MRI. X-ray is done to do, to make sure there's no bone spurs or fractures or dislocations, but the soft tissue can only be seen by MRI. For some reason, if you cannot do an MRI, which is magnetic resonance imaging, and you can see an MRI on the back of on my backside. MRI machine is where you go inside, the magnets take the pictures of the joints, and the provider or physician or surgeon can see it very clearly, the soft tissue. So soft tissue has to be seen by MRI. If you cannot do an MRI, if you have a pacemaker or other such devices in your body, then the next modality would be a CT scan or CAT scan. You can see the CAT scan in my back. The CAT scan is actually done through radiation, X-ray radiation. It's like a 3D X-ray machine. So there's other blood tests which you need to do as well to make a diagnosis of joint disease. That could include, for example, uric acid levels, or ESR, which is sedimentation rate, or CRP. So there are multiple blood tests which are rheumatologists, which is a specialist of joint disorders. A rheumatologist is actually medical specialist of joints and bones. Rheumatologists, they will do certain blood tests, because remember, everything is not gout or osteoarthritis. There are other conditions which can cause joint pain as well. For example, rheumatoid arthritis is an autoimmune disease. It affects multiple conditions in the body. For example, you can see it can cause weakness, tiredness, anemia, even abortions, and lupus can do the same thing. SLE, systemic lupus erythematosus. You can see on my backside, there's a typical patient with the butterfly rash on the skin, and then they also have joint pain. The other condition is psoriatic arthritis. If you have psoriasis, which is another skin condition, you can also present with the pain of the fingers and the joint pains, and that could be diagnosed by rheumatologist. The treatment is totally different than surgery. You will have to give biologicals or certain kind of medications to take care of that for those kind of conditions. And there's pseudo gout, which is not gout but look like gout. We call it pseudo gout. That's another kind of crystals which get deposited in the joints and cause pain. That is also treated medically. So there's a few conditions. So let's wrap it up briefly so we don't go, I don't overwhelm my audience. So at least they have some basic understanding. So we have two kind of pain, joint pains, mechanical pain and inflammatory pain. Mechanical pain is the pain which gets better with rest, gets worse with exercise. Inflammation pain gets better with exercise, gets worse with the rest. Example of mechanical pain is osteoarthritis, like bone on bone. Inflammation pain is like condition like lupus, rheumatoid arthritis, and psoriasis, and other certain conditions like this. So that's the basic question we ask: which joint hurts? For example, gout will hurt the first part of the toe, and you can see on the hologram right here, this is the toe, which is pretty inflamed. I respond wonderfully to steroids and colchicine, and then you have to keep a low protein diet because that's how you get flare up of the gout. Certain medication like hydrochlorothiazide can also cause gout, and then we have to talk about for example, lupus you have to treat with prednisone, methotrexate, and there are other medications. We call them biological or immune modulators, and they are prescribed by rheumatologists. So, folks, on that note, I will call it end of the Dr. Fazil TV show for this month. We'll come back next month with a more interesting and useful topic for my audience. So please stay tuned. We'll be back with Dr. Fazil show till the next month. God bless you and God bless America. Thank you so much for watching Dr. Fazil TV show.